Hi, this is Jordan. I am a 35-year-old ulcerative colitis patient. In the beginning, I wasn't experiencing much pain. It was more just like blood in the toilet bowl. So I went to the doctor. This was in 2010. Um, and it took about 2 months before I got my diagnosis because at first my primary care physician thought I had a bacterial infection. So after a couple of different rounds of antibiotics, he finally sent me to a GI who diagnosed me with ulcerative colitis after a colonoscopy. So, time from initial symptom to diagnosis was about 2 months, just shy of my 27th birthday. I didn't really experience any shock with the diagnosis. I was mostly relieved actually because I'd been sick for quite a while and had no idea what was going on. Never heard of ulcerative colitis before. So now with a disease name and a diagnosis, hopefully there was a treatment plan that now I could implement to help me feel better. So yeah, I was relieved to now have a name to what was making me sick. Um, as far as impacting my mental health, the disease, there's so much more to it than just the physical symptoms. I mean, during my flare, I was put in remission for the first year and a half. And the second year and a half before my surgeries, I was in and out of a very severe flare. And the way I described it was imagine having anxiety and being nervous whenever you're not in your own home. If I was driving or if I was attempting to go to work or if I was walking around a store, you never knew when that urgency, that really, really urgent and painful stomach cramp would hit. You never know if you'd be able to make it to the bathroom on time. It was just a nightmare being outside of my own house. I really didn't like to leave the house at all because you just never know. So there was a lot of anxiety that went into it. My body image now is okay. I have quite a few scars from my J pouch surgeries. And the questions I get today, it's like, oh, did you have your appendix removed? What are those scars? So I just kind of have to explain it to them that no, I didn't have my appendix removed. But when I was in my flare, I lost about 35 pounds. I was very skinny. I was sickly looking, sent home from work because I didn't look good. And then for 5 months, I had an ostomy bag when I was going through my surgeries. And maybe it's because I viewed my ostomy bag as, temporary. I didn't really embrace it the way a lot of patients do. I didn't like it. I was in a relationship at the time and I didn't want her to see me with my shirt off. I didn't want my parents or my friends to see me with my shirt off. I didn't want them to see me in that state because I knew it was only temporary, so I didn't want them to view me that way. And that carried over into, like intimacy issues, where I would sleep with my shirt on. I never took my shirt off for 5 months unless I was in the shower. And now, today I don't feel comfortable sleeping with a shirt on. So it was a big change for me, and it was, it was tough. I had a very supportive family, friends, and relationship at the time. Those relationships were tested, which also weighed heavily on the mental health side. But my own issue was I didn't want them to see me with my shirt off. And the piece of advice that I always give to patients is to be your own advocate, to learn how to ask the tough questions, because no one is going to look out for you the way you are, and to keep a sense of humor, because without it, you will lose your mind. There are some embarrassing situations and circumstances you'll find yourself in, so learn to laugh at yourself.